And as usual, this is for entertainment purposes, because otherwise I'm not allowed to tell you.
Flouroquinolones are a class of antibiotics that have been prescribed for years to treat everything from sinus infections to septic shock. But now some doctors are concluding that they should only be used in very specific situations. They say patients are suffering from nerve damage, irregular heartbeats, depression, and seizures because of the medication. The Food and Drug Administration is currently advising against using these antibiotics except as a last resort, but the drugs are still commonly prescribed for minor infections.
I shouldn't have to make this video, and you should not have to watch this video, but when the level of the average doctor's laziness and or incompetence reaches a certain level, then I have to reach out to you and say, hey, you need to be aware of this, even though you're not a doctor and it's not your job. This is very important. This is about a class of antibiotics that are very much overprescribed in the United States and in other countries that have a serious black box warning on the package insert and that harm thousands of patients a year that should not be prescribed for common infections, yet still are each and every day. I'm Dr. Ken Berry, a family physician. Let me explain what's going on to you so that you can be prepared to protect yourself and your family in case your doctor is just not willing to do the job that they signed up to do. There are currently 6 different drugs that are FDA approved in this drug class. And I'm going to put a visual up so you can look at this, maybe take a screenshot, come back and watch this again later and write these down. Moxifloxacin, Ciproflaxicin extended release, Gemifloxacin, Levofloxacin, and Ofloxacin. These are the fluoroquinolones. These drugs are very commonly prescribed by primary care doctors for such inconsequential infections as sinus infections, bronchitis, skin infections, and bladder infections, urinary tract infections. Now, first and foremost, you should understand that the vast majority of sinus infections and bronchitis are caused by viruses, which no antibiotic fights or treats or improves at all. So 85% of the time, if you have a sinus infection or an ear infection or a bronchial infection or a throat infection, it's a virus. No antibiotic on the planet is going to shorten the amount of time you're sick, is going to fight the virus, is going to heal you faster. The average doctor should know this. Many of them seem not to know this at all. So very commonly for a sinus infection, either Levofloxacin or Ciproflaxicin is prescribed for a sinus infection, which 85% of the time is viral, and the other 15% of the time, if it is bacterial, there are other less harmful, less severe, less powerful antibiotics that will treat the bacterial sinus infection just fine without all the disastrous side effects and complications that I'm going to tell you about in just a minute that come along with this drug class. The same goes for bronchitis. The vast majority of the time it's viral. You don't need an antibiotic at all. In the 15% of cases that are bacterial, there are very inexpensive, very safe antibiotics that will treat that bronchitis just fine without you having all the potential side effects that come along with the fluoroquinolones. Same goes for bladder infections and pelvic infections. 85% of the time they're viral or fungal. 15% of the time they are bacterial, but you can take a much cheaper, much safer antibiotic for them. So the question becomes is, why are primary care doctors, why are internal medicine doctors, family medicine doctors, OBGYNs, pediatricians, gerontologists, why are they prescribing this basically a nuclear bomb when all that is needed is just a small caliber rifle? Why are they doing that? Well, the majority of the time it's out of habit. They've been prescribing Cipro for bladder infections for years, or they've been prescribing Levofloxacin for sinus infection for years. That's just what they do. That's the only tool that they know how to use in the toolbox. So every single drug in this drug class has a black box warning that the physician should 100% know about and should 100% of the time discuss with you before they write the prescription and before you accept the prescription, fill the prescription, and take the prescription. So in this particular case, all of the fluoroquinolones contain a black box warning saying that they could potentially cause irreversible damage to tendons and to peripheral nerves. So tendinitis, tendon rupture, peripheral neuropathy, these things can not only happen, but they could be permanent. Very, very, very concerning. So every doctor, before they give you one of these fluoroquinolones, they should have, first of all, have an internal discussion in their own brain whether they should be writing this prescription or not for what diagnosis they've given you. But every single patient who receives a fluoroquinolone should give informed consent before they take that antibiotic. And what that means is that the doctor actually had a discussion with you. Hey, this has got a black box warning. It could cause permanent nerve damage. It could cause permanent tendinitis. I just wanted you to be aware of that. I think you need this antibiotic. Do you accept the risks of this antibiotic? To which the patient would either say yes or hell no. And that's what informed consent means. So how many of you guys have been given Cipro or Levaquin or Avelox? And you're like, no, the doctor didn't tell me there was a black box warning. No, they didn't tell me I could have permanent nerve damage from taking that. So you were not given a chance to give your doctor informed consent to use that treatment on you. I think that's kind of a big deal.
Well, when the FDA issues a warning about risks associated with medications, we expect our doctors to be the first to know. Well, it turns out they are sometimes the last to catch on, as a local physician found out after suffering a crippling side effect from a common antibiotic.
At my worst point, I had called local cemeteries. I gave my family my final wishes.
It was December 2016. Dr. Mark Galili of Beverly Hills should have been living his dream. He had recently completed medical training.
You're just getting started, it's exciting.
But his career and life took an unexpected turn.
I was at the gym, running on the treadmill.
All of a sudden,
I noticed I couldn't stand.
within minutes, he says,
I was on the floor, crying, grasping for life.
he had lost control of the muscles in his legs.
I was completely debilitated.
As he Googled his symptoms, he noticed something in common with other people suffering similar experiences. Like them, he had recently been sick, and
I was prescribed a common antibiotic called Ciproflaxicin for an infection that I had.
Ciproflaxicin, commonly known by its brand name Cipro, is one of a class of antibiotics called fluoroquinolones. Drugs Dr. Galili routinely prescribed to his own patients for things like sinus and urinary tract infections.
You know, as a medical doctor myself, every medication we prescribe, there are hundreds of side effects, but you would never think there would be such severe effects.
Until it happened to him, within a week of starting the medication.
I was completely crippled. I had to physically crawl.
On message boards, Dr. Galili found countless stories just like his, from people who said they took the same antibiotic.
I said, oh my God, this drug poisoned me.
But getting help, not so easy.
Most of my physician colleagues had actually thought I was making this up or fabricating the story. They had never heard of this condition occurring before.
Turns out there's been thousands of formal complaints. So many that in May 2016, the FDA warned that fluoroquinolones, including ciproflaxicin, are associated with disabling, potentially permanent side effects that can involve tendons, muscles, nerves, and central nervous system.
It was just unbelievable what a medication that is so commonly prescribed can actually do to someone. If my life had ended at that time, I would have been okay with it.
Galili had to travel to San Diego to find a doctor experienced in fluoroquinolone toxicity. He then turned to alternative therapies to begin to heal. After 6 months confined to a chair, he says a stem cell infusion ultimately got him back on his feet.
Within 6 weeks after I received the treatment, I was actually walking again.
How did you do the research?
Dr. Galili is back at work now, but the course of his career has changed. Priority one,
I'm hoping to raise awareness
he wants other doctors
to really consider the risks and the benefits when they do want to prescribe this class of antibiotics. I believe it should be used as a last resort in the case that no other antibiotics can help cure a condition.
And while he wouldn't wish his experience on anyone else,
It's a blessing in disguise going through an experience like this, because it really opens your eyes to what your patients are actually suffering and going through, how devastating their diseases can be, and to offer them a helping hand.
Doctor is doing much better now. Now, Dr. Galili told us the stem cell treatment that helped him was an experimental procedure. The stem cells were actually harvested from his own fat. He is now focusing his attention on helping patients looking for answers on conventional medical treatments.
So, quinolones, what are they? So quinolones or fluoroquinolones, I'm going to use these terms interchangeably, are synthetic antibiotics derived from quinine. Common quinolones, you probably recognize some of these names, Cipro and Levaquin. On the generic names, notice the word flox in all of them. That's where we get the term floxed. So I developed some symptoms. It's a long list. And this first started happening in 1999 and continued up through 2012 before I had any notion of what was causing all of this. Most of this stuff emerged during that first 13 years, and no one could understand what was happening to me. I'll give you guys the first 13 years of how this went down. 1999 was when I was first given a quinolone, and while I was on the drug, it was Cipro, I had a little bit of anxiety and a little bit of insomnia, but nothing too significant while I was on the drug. After the drug was discontinued, though, for the next several months, I developed more severe symptoms. So very hard insomnia, depression, mental issues, focusing, memory issues. One of the things that was really kind of bizarre was I started to feel very strange sensations in my body. It started with tickling, a little bit of like an itching sort of feeling, and that escalated into numbness and sharp stabbing pains just randomly. You know, I now understand this to be neuropathy, but at the time, I didn't know what it was, and no doctor really could put their finger on it either. So this continued for years, and I was given additional prescriptions for quinolones during this period of time. And when this was happening, the symptoms worsened. After the second or third round of quinolones, a few months after that, I started to have anxiety that was so severe, it was essentially what I came to be understood is called panic attacks. But what was different about this was, what I read was that panic attacks typically last 5 to 10 minutes. My episodes would last hours and days. Very difficult to deal with. So we're in 2002, 2003 time frame, and life had become so difficult due to these brain issues and these nerve issues. And another thing that emerged was chronic fatigue. I was tired all the time. It made life tough. It affected my work life. What I did during the day. It affected pretty much all of my relationships. Things were pretty ugly, and the symptoms were continuing to escalate. And I didn't know what was happening. I went back to the doctors and complained about all these symptoms multiple times. And the symptoms were severe enough that it caught their attention, and I had an EKG, I had an MRI on the brain. I was convinced I was going to die. I felt so bad. Multiple blood tests. All this stuff came back normal. And, like I said, I wasn't really functioning. It just seemed like a paradoxical situation that made no sense. The official diagnosis at that point in time was anxiety disorder with severe somatization, i.e., it's all in your head. There's some other odd things that happen, like muscle fasciculations. I would get these twitchings. And given that that was observable by anyone who wanted to look. It didn't seem like a psychosomatic symptom. So again, I got prescribed more quinolones, and things worsened. And essentially what happens at this point is I get put on an SSRI, and I have a prescription for Xanax, which helps me manage some of the symptoms. But due to not making too much progress with the diagnosis, I kind of stopped talking to doctors. So I just learned how to live with it, which is difficult. When I stopped talking to doctors, I actually recovered a little bit at that point. Two reasons. One is that I wasn't working a normal day job anymore because I was too ill, and the other, so I didn't have health insurance, so I didn't go to the doctor, so they didn't prescribe me more quinolones. So I got a chance to heal. Didn't realize all this at the time, but that's kind of how it went down. So things continue to escalate symptom-wise, and we're in the mid-2000s now. What I remember thinking about this at the time, well, it was a mystery, first of all, but second of all, the experience was so uncomfortable and so horrifying that even though I was starting to feel a little bit better, I knew that this was not an experience that I ever wanted to have again. Essentially, it was not something I had any interest in living through a second time. I received another prescription for, this time, Levaquin, and things got a little bit worse. The neurological symptoms weren't too bad, but I picked up a new situation, which is in the month after the Levaquin prescription. I started to experience some popping and clicking sounds coming out of my joints, and that lasted for about 4 to 5 weeks, and then it went away, which I thought was the strangest thing at the time. I had no idea what could be causing that. Later, it turns out to be important. And so now we get to 2012, the summer of 2012, and I refer to this event here as the Great Unveiling. So again, I find myself in the doctor's office, and I'm prescribed Cipro for the 5th time, and I start the meds, and during the first week, I experience a significant escalation in anxiety and cognitive issues and dizziness. It was bad enough that I'm just calling in sick to work because I just feel bad neurologically. I tell the doctor about that. He advises me to continue to take the Cipro. He actually winds up writing me a second prescription for a second week, and I take it. So on the 4th day of the second week, I have a major event that happens, and I find myself in a state where I'm nearly unable to speak. If you ask me a question, and even a very simple question, I have to think hard. I have to work to understand what's being asked of me and how to formulate a response to that, even if it's a yes-no response. But that wasn't the worst of it, though. I'm feeling extremely agitated and in a state of inner turmoil. And this is so bad that I can't sit down. I have to stand up. I have to continually pace. I have to keep moving. And this isn't a rational thought process. This is, it's like the fight or flight response has kicked in. I have to get away from a threat, and I can't do that because the threat's inside of me. It was a horrible, horrible feeling. So at this point, I Google this, like what is up with this pacing, this I can't sit down, and Cipro. And what Google comes back with is a website that's maintained by a psychiatrist in California, Dr. Jay Cohen. And the first page on his website that comes up is quinolones can cause akathisia. What's akathisia? I have no idea at this point. So I read this, and he says it's a state of extreme agitation, turmoil, where patients typically cannot sit down. They must pace. They must continue to stay in motion. And it's an extremely dangerous condition because it frequently results in suicide. It's an unbearable state of existence. So now I know I'm in trouble, right? And I investigate the rest of this doctor's website, and it's a great website. But essentially, what I learn is that for the past 10 years, he has been documenting what he thinks are the side effects of the entire class of quinolone antibiotics. And he's talking about things like neuropathy, chronic fatigue, mental health issues, akathisia. And this is a 100% match for everything I've been complaining to doctors about for the previous 13 years. We have an answer. Not a solution or a cure, but some kind of diagnosis from Google. I survived this basically through the support of the community of people on the internet. And speaking of that community, it turns out that this community of people that this has also happened to is rather large and knowledgeable, and this has apparently been going on for decades and has not been publicly discussed, but there are thousands of people communicating online on social media that have all had similar experiences. So it was a good thing that they were there to help me. And let's see here. So I wanted to talk about, we still have the symptoms here, and the doctors, they see a list of symptoms like this, and it doesn't match any disease process that they know of. So that's where they wind up with anxiety disorder and its somatization. So how do you get this extensive list of symptoms as a drug reaction? Well, in the case of quinolones, we're not 100% certain, but we do think that we have an insight into how they do their damage. And essentially, there's a couple of key things that they do that can cause a symptom list like this. One thing is that they're neurotoxic, so they can damage nerves. These drugs are designed to penetrate membranes. This is an issue with antibiotics, that it's difficult to get antibiotics to penetrate membranes, so these drugs were designed to get into certain places like the brain. They also damage connective tissue, tendons. The thing that I think I got hit particularly hard by is they inhibit the action of a neurotransmitter called GABA, which stands for gamma aminobutyric acid. And that's probably something I might have mispronounced, but GABA is the primary inhibitory neurotransmitter in the nervous system. So by inhibiting GABA, your nervous system becomes unregulated. When the nervous system becomes unregulated, that translates into anxiety, insomnia, neuropathy. It amplifies pain. So a lot of the stuff here are neurological symptoms. So between the action on the central nervous system and GABA inhibition, you get a lot of this. And I want to talk about genetic damage. So one thing that's very unusual about quinolone reactions is that oftentimes the more severe symptoms occur after the drug is discontinued. And this is very different than a usual understanding of a drug reaction, which is that you discontinue the drug and the symptoms go away. Quinolones, the symptoms can get worse, and in my case, they certainly did. How is that happening? Well, the way quinolones kill bacteria is by interfering with DNA replication. And the understanding for the longest time is that they do this with bacteria, but they do not do it to the human cells. I suspect, and a lot of people suspect, that assumption is incorrect. They damage potentially human DNA. So in a sense, quinolone damage looks a lot like radiation poisoning, where during the exposure period, there may be some symptoms, but the more severe ones will come later as your cells reproduce and find themselves unable to do so correctly. So while all this is happening to me in my own personal life, what's going on in the outside world regarding our knowledge of quinolones? The FDA, mostly in the mid-2000s, has been updating the warning label. They have discovered that these drugs damage tendons. There's a update for peripheral neuropathy, which is fine and everything, but no doctor that I talked to in my area was aware of any of this. They had no idea. They were thinking 100% safe, no issues. This was not true. After my 2012 incident, the great unveiling, it takes me about 2 years before I can really function at a level where I can do anything about this. I'm essentially just trying to stay employed. And when I am able to do something advocacy-wise, I pursue that, and I wind up talking to members of the media, talking to some Congress members. I work with a lot of people I worked with a lot of people in this community that have also been damaged by these drugs. A big thing that happened was we got possession of an internal FDA memo, and in this memo was a pharmacovigilance review, and the FDA researchers say some pretty ominous things about quinolones. And the worst of it to me was that they believe that at the cellular level, the damage that you see from quinolones is the same kind of damage that you see from ALS, Alzheimer's, or Parkinson's, which this is why I've been in so much misery for 13 years at this point. So what winds up happening due to the advocacy efforts of a lot of people is that the FDA holds a hearing and updates the warning label, creates a term called FQAD, which stands for fluoroquinolone-associated disability. And big thing about that is it contains all those symptoms I talked about and mentions that they can be long-lasting and or permanent. So this was good. However, it still didn't really get to, that information really didn't make it out into the field in any kind of efficient manner. And we're still working on it. That's still a problem. So I've got a couple of slides here that talk about what I ran into in terms of physician response, a little bit on the label history. So I think that the FDA unfortunately really failed to do their job when it came to the quinolones in any type of reasonable, efficient manner. And I wanted to spend a few minutes here to talk about things that contributed to that. I have to say up front that no one really knows the full story as to why the FDA took so long and why the situation was so bad. But a couple contributing factors to this. So I think that in general, there's insufficient scrutiny on mental health side effects for all drugs that are being approved. We see this being a problem not only with the quinolones, but also the opioids and SSRIs. Insufficient tracking of outcomes on a longer-term basis. They only generally look for side effects while a patient is on the drug. The way this works is not that situation, and no one was looking for that type of series of events. The post-market surveillance mechanism for the FDA is a program called MedWatch. It relies on voluntary submission. Not too many people report adverse events. Physicians are not so quick to do that. This one's complicated, but I'm just going to touch on it briefly. The legal environment is been changed such that it's difficult to file lawsuits and have those pursued successfully, which means that the court system is no longer the regulator of last resort. And for quinolones, especially Cipro, the threat of bioterrorism was a major concern. And Cipro was the wonder drug that was going to protect us from drug-resistant anthrax. And I think that the desire was so strong to have a drug that was safe for that purpose that some of the safety issues were overlooked. So, and that's pretty much the story. You're free to connect with me online, Facebook. My email address is on the slide deck here, which Kevin's going to post. And I love to talk about this. So, thanks for listening, and thank you.